Hello everyone, my name is Michelle Hintz and I'm a student at University of Phoenix completing my master's program in nursing administration. My current class is Research Methodologies for the Nurse Administrator. This week we are focusing on internal and external forces of change. I am currently working on my practicum project, which is focusing on induction of labor in pregnant females. There's a vast amount of research available that supports my change project. Elective induction of labor prior to 39 weeks has been associated with complications for both mother and baby. To name a few, there are higher percentages of women that will need C-sections from being induced too soon, as well as a higher number of admissions into the special care nursery, as well as the neonatal intensive care unit. My hope for my project will be to educate staff on the importance of allowing spontaneous labor to begin and to implement a change process to ensure that this happens. With any change comes resistance, and I anticipate that meeting the most resistance will be with physicians as well as nurses that perhaps are kind of set in their routine. I plan to educate them and provide them with the most up-to-date information, as well as provide them with additional resources if need be. I hope to utilize tools such as the Bishop Scale, which assigns a number based on several criteria that show how favorable a woman's cervix is for labor. There will also be nurses and physicians that feel that the change is well overdue, and I plan to utilize them to strengthen my cause, as they will be a major part of the driving force behind this. As healthcare professionals, our main goal is always to provide safe, quality care to our patients, and this must remain our focus. There will be internal and external characteristics to consider. Internal characteristics focus more on things such as fear, motivation, feelings, and external characteristics focus more on appearance, maybe what someone is good at or who that person is. In relation to my project, the internal characteristics to consider would be what are the fears and motivations of physicians or nurses that support induction of labor before the 39-week mark. Some considerations could be fear of harm if the neonate is carried to 40 weeks gestation, or fear of malpractice suits from a patient. Fear of not being well liked by a patient could possibly be a motivator. Motivational considerations could be money. So the sooner they get a patient delivered, the sooner they get back to the office, to the other patients, and make more money. External characteristics to consider would be if a patient possibly lives a considerable amount of time away from the nearest hospital. There are many other factors to always consider when implementing a change project, which is why it is crucial to complete a needs assessment prior to trying to implement any kind of change. You must first understand what the need is, as well as the viewpoint of staff. A needs assessment will also help identify driving forces that can be utilized to help the project move as it should. Buy-in is imperative from bottom to the top. Nurses are the ones on the front line and who see firsthand the implications of inducing a mother too soon. We see the effects of her body not being ready for labor and what that then means for her and her baby. We see the extra time and pain that can come as a result of this. It is up to us as nurses to stay current with evidence-based practice and always advocate for our patients. My goal is, as always, to have a healthy mom and a healthy baby.